Kijura Town Council in Kabarole district is synonymous with sprawling tea estates, substantial wealth and general well-being of the population. Ironically, Kijura is struggling with the challenge of sanitation and hygiene at household level. With about 2,800 households, Kijura Town Council latrine coverage is 81%. This is slightly lower than the district average of 85%. This means that 11% of the population in Kijura Town Council does not have a latrine at all. This is an indicator they're practicing open defecation. In July 2017, the Albert Water Management Zone, in conjunction with IRC, International Water and Sanitation Center, undertook a rapid water quality assessment on groundwater in Kabarole district. It showed that 80% of the water sources sampled across the district were contaminated with E. coli.
About 80% of the water sources of Kijura were all contaminated with human feces, and that is called E. coli. Then we had also total coliforms. Some of the water sources were too numerous to count. You couldn't count those colonies. So when it is too numerous to count, it is so sick.
The water sources that were tested in Kijura included Kasokero Shallow Well, Kijura Nema Shallow Well, Chakabaiha Pump Stand, Cheitamba Borehole, Chabanjasi Shallow Well, Sunday Shallow Well, and Bulera Shallow Well. Many water sources were contaminated. Latrines were in a poor state and constructed near water sources. The area suffered flooding from rainwater and drainages were clogged. The risk of disease outbreak was real among the communities. Following the survey, IRC organized a water safety planning meeting for technical staff in the water and sanitation sector and senior community development officers, during which the findings were disseminated. A red flag was raised for Kijura Town Council during the dissemination meeting, and the community development officer for Kijura was in attendance. Pondering on how to reverse the situation, the senior community development officer in Kijura Town Council, Kellen Kanyunyuzi, requested for a council meeting, which was granted, and he got an opportunity to share the challenge at hand and urged the political and technical leaders to seek solutions urgently. Ironically, it was revealed a number of leaders in Kijura Town Council were not compliant with the required minimum sanitation and hygiene standards. One of the measures agreed on was leaders to first address sanitation practices in their own households if they are to be effective advocates for hygiene and sanitation compliance among the rest of the population. The recommendation was unanimously adopted as a council resolution. This marked the beginning of a campaign to promote sanitation at household level, starting with leaders. The campaign was dubbed Sanitation, Start With Your Leaders. It was expected that if behavior change started with leaders, the rest of the population would follow suit, and this would lead to 100% compliance among all residents. Ultimately, contamination of water sources would be reduced, leading to increased and sustainable water safety.
Well, most households did not have toilets. And what was, let's say, embarrassing was the leaders themselves did not have these things in their households. So why I started with the leaders is to help them change, so that they can help me influence the rest of the people, so that the community can change.
Following the council resolution, leaders of Kijura Town Council from the 4 wards undertook a spot inspection of households in different wards. Many households were short of the required minimum standards of sanitation and hygiene. Kijura is predominantly a tea-growing area, which means there is an influx of people with different behaviors and cultures. This often means non-adherence to agreed standards, making the town prone to disease outbreaks.
Most of the people who work in the tea estates, they are not residents of this place. They come from other places to come and pick the tea. So never know, one of those can introduce the germ in the area, and if it finds dirty water sources, dirty environments and dirty behaviors, the disease can break out.
Gonzaga Gacharo is the LC1 chairman in Saro Kahuna ward. He did not have a bath shelter at his home because he initially didn't see the value of having one. He confesses he realized the importance of a good and clean bath shelter after he was taken through a training on water safety conducted by the Kijura Senior Community Development Officer, supported by the International Water and Sanitation Center. The training was organized for local political leadership in Kijura. For Chairman Gonzaga, bathing was only confined to nights.
Kuri akanabiro kantakacu twarakachukuru beti twatunjiro obuhabuzi bwa kanso ate nateche nabiro n'ikintu cyukuru munonga ubwiro bunayenderamu nitekwa kuzo mu ryogero nabo twankira kunabo mu kiro beti hati hone hi wayendera no naba ahabwo buhabuzi uko twahabwiye.
Gonzaga has since constructed a drying rack and a rubbish pit. Prior to the training, these were not important items to him. Communities are encouraged to construct racks and rubbish pits in order to reduce on the likely contamination of water and food.
Households that did not have drying racks, they would hold maybe a basin or a saucepan and keep piling dirty dishes within the place. So by the time a child comes, picks a dirty cup, drinks water, and it's already contaminated. So that's why we're encouraging dry racks.
The lack of total sanitation applies to many leaders in Kijura Town Council. The Town Council Speaker equally did not have a presentable bath shelter and has since fixed his toilet with satopans. He is today working around the clock to fix the kitchen so it can meet acceptable standards. According to the chairman LC3 Kijura Town Council, it was difficult to enforce the council bylaws when leaders were themselves not compliant to sanitation and hygiene standards.
We went to leaders, we found that the difference was very little. Some of the leaders also had no latrines, had no kitchens. So we made this campaign that let us start with ourselves, with leaders. From there, then we go to the local community.
Indeed, there was need to save the leaders from embarrassment.
Where we are now, the leaders have improved. The leaders have improved. At least a good number of leaders, they have latrines, they have kitchens. So the picture is good. We said after this campaign, anybody found without a latrine, without a kitchen, we are going to arrest him or her.
Today, LC1 Chairman Gonzaga is not shy to mobilize communities to address hygiene shortfalls in their households. He says his agenda for the next 5 years will be ensuring total sanitation and hygiene among his electorate.
Nyonka chairman wansoro kahunda mazira kutebekanisa yakayanje nirebe kaje umbugambe kwatagaye ne byo buyonjo byona biriho tari kitariho kandi nyino bwisugenti abantu nubaraza kugakamo kwa mobilizinga abantu abampira karuru n'abatarampira karuru bona babase ukukora ibintu by'ubuyonjo amakagabo gashwane naganje.
As the campaign takes shape, another area of concern being emphasized is the construction of proper latrines, complete with hand-washing facilities. The benchmarks set by the Council to achieve the objectives of total sanitation require, among other things, each household to have a proper toilet. The toilet has to have a door, hand-washing facility, cleaning materials inside the toilet, smooth cleanable walls and a floor. Toilets in use shall not be less than 3 feet deep and 6 feet in height. Thus, a standard toilet should be conveniently located, ensure privacy and be cleanable. Short of those standards, the facility becomes risky to users.
A poor latrine, what you can call a basic latrine, which does not meet all the essentials of a proper latrine, is going to lead to contamination of water sources by itself or by creating desire for people to do open defecation. In one meeting for the councillors, at least latrine improvement during this campaign was done by fixing satopans. That a satopan is simply an addition on a latrine that would fulfill some certain conditions by not exposing the feces to the user, preventing a smell or odor.
Hand washing with soap has been one of the critical aspects of the sanitation promotion campaign in Kijura Town Council. This has resulted into the increase of TP taps as hand washing facilities at household level.
Mu bwiro bwahuireho twatakamanya mugasho ogwakapira hamwe na sabuni wano rugo mu toilet. Chaka twatungira kuhaburwa ngo ibintu ebyo ni bikuru. Twabasa kubiteka ha toilet kandi umutwe kurwo mu latrine atekwa kunaba n'amezi atari kwata akapira akwata n'akasabuni anaba niwo rugahorije umanyongo byo buyonjo toinekiza bucona twabasha kugenda nacho.
Tea estates in Kijura haven't been spared either. As many of them have no toilet facilities for their laborers, they've been pointed out as a major source of water source pollution, especially during the rainy seasons. Hundreds of people work for long hours in these estates, yet there is no provision for sanitation facilities. The storms from the tea estates end up in water sources. After rigorous meetings between the Kijura estate owners and the town council authorities, latrines are being put up to cater for the workers who are largely practicing open defecation. Soon enough, they will also include hand-washing facilities. Water safety improvement plans have also been developed for the water sources that were sampled and found contaminated. Water source committees have been established and user fees introduced to cater for water source operation and maintenance. As Kijura Town Council political leaders quickly turn into sanitation champions, focus is now being turned to schools where sanitation and hygiene clubs have been formed. These are expected to be the game changer as children will act as hygiene and sanitation ambassadors of their communities. The hygiene and sanitation clubs will be equipped with knowledge of how to pass sanitation messages to their parents. Health facilities, VHTs and places of worship are other opportunity areas that have been earmarked as platforms where messages for sanitation shall be channeled and delivered onto the people. All these efforts are geared at redeeming the contaminated water sources and moving towards total hygiene and sanitation standards by the end of 2018.